to questions. We want to hear from you. So please don't be shy. We would love to hear your questions, your thoughts. Feel free to pop them in the chat if you would like. And we will start to take questions now.
Excellent. First of all, excellent job, Crystal. Thank you. Really appreciate the broad spectrum discussion. And yes, we've already got some questions that I have been fielding in the chat. So 1 second. So this one looks like a kind of a 2-for-1, if you will. So there's two parts of the question. So our first inquiry is, what are the biggest barriers to providing effective trauma-informed care in the NICU? And then to follow that part of the question up, and how could remote patient monitoring help alleviate these challenges?
That's a great question, Christopher. Thank you for that. And, one we haven't touched on much yet. Trauma-informed care is starting to get a lot of attention and traction right now, and for very, very good reason, right? Trauma-informed care, if you're not familiar with the concept, is us really doing a better job of understanding how the care that we deliver to our patients when they're in the hospital setting, how that impacts them from a trauma standpoint. So, are they walking away feeling violated or unheard? Or, even if we provided really good clinical care, did we support them emotionally and culturally, and address all of their needs holistically? So I think we have a lot of room to go when it comes to trauma-informed care. And one of the ways we can do that is by considering products like this, where, we can really transform our ability to support families in a way that's very different with products like the product that we're talking about today. And one of the things I really like about it is when you have fewer wires, you can do things like swaddle a baby when their weight is appropriate. And these small little things, while they may seem small clinically, they have a huge impact on the trauma of the parents and the families that are there supporting the child. So when they come in and they're able to see their baby clothed or wrapped and swaddled with, nothing but maybe an IV in the wrist or something, that does so much to improve the amount of trauma that they endure and allows them to bond more effectively with their baby because they don't appear as sick, right? And so these are the types of things that we have got to prioritize and we have got to invest in so that we can really help reduce the long-term trauma impacts that our patients and the families endure when they have a family member in the hospital.
Excellent. All right, so let's see. We've got a second question here. Can you provide examples how this technology supports safe discharge planning for postpartum moms and their newborns?
Another great question, Christopher. Thank you. Yeah, this is one that I've been thinking about a little bit too. And I've done a little bit of work in postpartum myself too. And especially, with first-time moms, or if there's a mama who had a baby that was like, had maybe some concerns during pregnancy, but was born healthy and doing okay. Oftentimes I hear so many moms say, what can I do when I get home to make sure that my baby's safe? Like, I'm never going to be able to sleep. I'm so scared. And having a product like the Aulisa Guardian Angel product really just helps to alleviate some of those. So even if there's not a glaring medical concern from the clinical team that says, this patient really needs to be monitored when you go home, we have to consider the emotional anxiety and the stresses that the families are considering or that they're going through as well. And so a product like the Aulisa Guardian Angel can help alleviate some of those anxieties so they can focus on the things that really matter, like, feeding schedules and bonding and, accepting meals from family and neighbors and all of those things. It's so nice for them to put their mind at ease that their baby is fine. And, and then they can stop monitoring when it's convenient for them. And also then when it comes to the NICU kiddos, the same way. If they have stress and anxiety related to being home, so many mamas will say this to me going home from the NICU, right? I've stared at a monitor for, 3 days, 3 months, 6 months, whatever it is, however long their NICU stay is. And I'm terrified to go home without that monitor. And this just really allows that, whether the clinical team needs that reassurance or the family needs that reassurance. It's a very cost-effective way to alleviate those stresses and be able to provide a safety net around that transition to discharge home.
Excellent. So the next question I hear all the time, especially at some of the shows, the national shows that we're going to. So this is excellent. So in what ways could this technology support parental bonding, especially during prolonged hospital stays when physical interaction might be limited?
Yeah, that's a great question. As a NICU nurse, I am a very strong proponent of skin-to-skin care. There's so many great benefits to skin-to-skin care. And if you've ever been a NICU nurse that tries to put a baby skin to skin when you've got, a vent and lines and monitoring cords and so on and so forth, it can be a little daunting. But eliminating some of that, so it's just that much easier to get that baby skin to skin, is just so imperative for that bonding piece of it. And again, back to that psychological component of just less wires. These kiddos sometimes can have so many tubes and drains and wires. If we can eliminate, a handful of them, that is going to be huge, just tremendous for the parents. And it really does help to increase their ability to bond with their babies.
I like this question too. Kind of touches upon value-based medicine, data collection, lots of different things. How do you see this product improving real-time communication and decision-making between healthcare teams and families during emotionally challenged moments?
Yeah, this is great. So I come from a background where every NICU that I've worked in, it was standard practice to do continuous monitoring. So I'm pretty accustomed to that continuous monitoring expectation, which was always very nice because, we had the data pretty quickly. My favorite part, though, is that trending piece. I think this is really revolutionary, and it's really going to change our communication and our ability to intervene very quickly. So like I had mentioned with my example, when we're able to get down into the trends and the nitty-gritty, we can really see, identify, and communicate much better. So instead of a nurse like me saying, hey, I've got a hunch, like something just doesn't feel right, and those vitals just seem a little off to me, I actually have data now, right? To say, there's a 15% change in heart rate, or I've gone up X amount of this or that or whatever. I now have data to back my hunch or my suspicions, or his color is a little off or something's not right here. So it's another assessment tool that gives us data that we can use to create a plan. And the other thing that I really enjoy about it is, for my example with the kiddo that became septic, and I'd been advocating my whole night shift, we weren't able to communicate with the parents until things were awful, right? And you get that awful call that, your kiddo is really, really sick and we need you to come to the hospital right now. If we had the ability to really identify and start intervening a lot sooner, we could have had a much softer, much more delicate conversation with the parents to say, there's a little bit, we're seeing some small changes. We're going to be proactive. We're going to start doing these things. We're going to be doing our labs. We're going to be doing a few things. And it just makes for a much, much nicer, much more nicer conversation, and really improves our communication clinically and with the families.
Excellent. I was going to ask this one question, but I'm going to move it up kind of as a follow-up to what we just talked about. So this question reads, how might this continuous monitoring technology help bridge gaps in trauma, inform care practices for both infants and families? I know you've talked about this a little bit, but talk about a little bit more in regards to filling up the gaps, communication, lots of different things, data collection.
Yeah. Yeah, absolutely. I think we definitely have talked about it a lot, and for a lot of good reasons. I think that you're getting so many questions around that trauma-informed care because I think we're finally opening our eyes as clinicians on just how important this trauma-informed care is, and how we really need to shift. Obviously, we have to do an amazing job at the clinical piece, right? We have this certain expectation that we have to deliver exceptional patient care, but it can't just end there. It can't be, it can't be just about the, that you administered the med on time and that, you cured a disease or whatever. We have to look more holistically on, more details around, was our care compassionate? Did we address the other needs that the patient had, maybe around social determinants of health or so on and so forth? And certainly investing in products that help to support an environment that feels warm and homely, and you have the ability to do things like swaddle, and maybe walk around the room. We all know that, when you have a baby, if you're kind of bouncing and walking them around the room, just how much more comforting that is, to a baby. And so having access to products that support the bonding is so critical. And we also know there's so much literature out there that tells us that not only is it important for the parents, but it is crucial for brain development for the baby as well. They are already establishing so much development in their brain. And that trust and that security and that bonding of their parent is critical for their development and their long-term outcomes as well. Hope that answered your question, Christopher.
No, that's fabulous. I think this is probably one of the big ones on most people's minds right now. You've kind of talked a little bit about this based on your experience. How do you think remote patient monitoring can specifically reduce caregiver fatigue and stress in high pressure NICU environments?
Mm-hmm. Yeah, that's great. And the reality is that the NICUs are always going to be stressful environments. They just will. Obviously we have somebody's most prized possession in our hands, and it's a lot of responsibility to take care of these little babies that are critically ill and do our very best to keep them healthy and safe. But again, I think especially at being a healthcare leader for as long as I have, we cannot stop looking for innovative solutions to provide better outcomes for our patients. We cannot stop. And technology is a wonderful way to do that. And Aulisa has such an amazing product that really ties both of them together, the innovation as well as the technology to help elevate your care and ensure better outcomes. But also it reduces that fatigue from the nurse. The nurse is going to feel more comfortable and confident in how her patient is doing when she has access to continuous monitoring. She has access to really dig into the trends of the data. All of these things show the nurse that your organization cares enough about you to invest in products that are going to make your job easier. Her job will still be hard, but it's just one more piece that helps alleviate some of that ongoing stress and pressure in her role. And the customizability of this product truly is amazing too. I can absolutely see so many of my colleagues and friends. I think the fact that I can have it on my cell phone is amazing. I love that. I can be at my lunch in the break room and I could still have eyes on my patient and know what's going on. And that brings me so much comfort, right? I can actually go and just enjoy my lunch and I don't have to stress and worry about what's going on while I'm away. There's so many things that I think really help support the nurse in her shift when she has access to this product.
Excellent. All right, we're going to wrap this up here with this last question, which I think is fabulous. How do you see this technology evolving into the standard of patient care?
Mm, that's a great question. And I mentioned it before. If you are not in a space where you're continuously monitoring in a NICU setting, it is imperative that you get there. This truly does have to be the standard of practice in every NICU nursery type setting. There's really no need, there's no reason not to have it, right?
Sure.
This product is very cost effective, and your investment on the product is there's just really no reason not to, right? One bad outcome and
Sure.
it's a awful day for the hospital as well as the family, right? So we truly do need to shift our mindset away from every 3 hour vital sign checks to we need to be continuously having eyes on our baby. So that's number one. Number two, the freedom of the wireless piece is the icing on the cake, really, that really helps to support the baby and the family, as well as the nurse. The baby and the family have the benefit of being able to bond better and all of those components, as well as the nurse just having that freedom of not having to have physical eyes on the patient all the time or to have to remember to do her vital signs. So it really needs to be the wave of the future.
Well, Crystal, thank you so very much for joining us, and we always appreciate your guidance and your thoughts in regards to keeping real time with the business and obviously taking care of patients. And Aulisa wishes to thank everyone for participating and taking time out of your busy day to join us. So that's the conclusion of our webinar, and we'll be following up with everyone in regards to your questions that we weren't able to ask. And have a great day, and we look forward to seeing everyone.